All right, let's test that. All right, thank you, Andrew. I appreciate it. I am so thrilled to be here. This is my third alumni partner lunch. The first one I came to. Hi, Carol. Nice to see you. The first one was in December of 2019, just prior to taking on this role, and then we had that horrible thing called COVID. So it's really a pleasure to be with you all today. I'm going to stick to my notes, so I'll be reading a little bit. But before I start, I want to do a little thank you. My son and husband are here, and this is the first time they've had an opportunity to do that. And they truly have been a support and a gift for me in doing this work, and I do want to recognize you all both, so thank you. All righty, so I want to talk a little bit, my time is to share some of the highlights in the work that Arcora has been engaged in. And, you know, we have a phenomenal board, and we have phenomenal partners that we work with, and so let's share a little bit of some of that. So a couple of things that are really critical to our work is our partnerships with community members. This is a way for us to celebrate you, and partners. A couple of examples of where we've had some real progress in that is with the Pacific Islander community. We've worked with them, and this is what community engagement can really look like. We know that data has shown that Pacific Islanders have a higher risk of diabetes. And from some of those chronic health conditions, they can have negative health outcomes, especially if there's a high level of sugary beverage consumption. We identified that opportunity for behavior change with a social media ad campaign. Some of the campaign goals were to decrease sugary drink and consumption while promoting healthier beverage alternatives by highlighting the shared community values of hospitality, which surfaced with audience research. And I think that's a fancy way of us saying that we've had conversations with our community partners. You know, what is the good and why you're doing what you're doing, as opposed to us coming across as, oh, we're the experts. If only you knew this, you could do better. It was really being in partnership with folks. Community members and families served our partners. Our Asian Pacific Cultural Center and Pacific Islander Health Board really helped inform our approach. Before work began, we'd already spent time getting to know people in the community, and the results was a co-created campaign that really pushed shared ownership. That shared ownership led to content that was both authentic and reflected cultural values important to Pacific Islanders. Some examples of this, we've got slides here, great. Examples are on these slides. So we had growing pains along the way, of course, but a solid basis for relationships helped us work through those issues. And so the campaign continues today. All right. So the other thing I want to share with you is Dentist Link and Project Access Northwest. And this is an example of partnership. We transitioned the Dentist Link program is a partnership between us and the Healthcare Authority. And we transitioned the referral services, handling calls and texts for care, to Project Access Northwest. As a reminder, Dentist Link is a free dental service in Washington state for people with Apple Health, also known as Medicaid, or who have no insurance. A year-long feasibility study led to the decision. It was necessary because upward trends in users. There's so much need out there, and we were getting a lot of outreach through telephone calls or text. We have partnered with Project Access Northwest on other efforts and know what a great organization it is. For this effort, we had to integrate systems, like software, IT systems, and train Project Access Northwest staff on Dentist Link processes. In October of this year, we had a smooth transition of all referral services to Project Access Northwest. This private-public partnership now includes Arcora, the Healthcare Authority, and Project Access Northwest. There's been no change in our user experience. But users who call and text now have, in addition to dental care, they also have access to medical and behavioral health care resources to help, and also to help access, let me pull up, also resources to help them access transportation or other kinds of social supports that might be needed, like utilities, support, that kind of thing. Dentist Link is really important because many folks who come to Dentist Link with multiple barriers, especially when they're calling local offices, don't have access to all the resources and know what's out there and available to them. Many private providers don't accept Apple Health, which leaves people feeling rejected and even treated unkindly. By the time they connect with us, they're understandably frustrated. But our referral specialists listen with empathy and help guide users towards solutions. This demonstrates success in expanded partnerships. Melissa from Arcora, who supports the Dentist Link program. Melissa, I know you're in the room somewhere. Would you wave? Where are you? Oh, way back there. Thank you. She trained Evan from Project Access Northwest. Is Evan in the room today? No, okay. But she did a ton of training with that team and in the referral specialist functions. Recent testimonial from a user in Spokane who praised Evan said we need to clone him and that they're now excited to call a dentist. And anybody who loves to go to the dentist and has no fear or anxiety is a rare bird, so we have to thank him for that. This positive shift is exactly what we're aiming for, turning frustration into empowerment through compassionate care. And now I'd like to transition to Dr. Doug Jackson. Dr. Peter D'Amato passed away earlier this year, and some of you may know about him and his legacy, and we'd like to have Dr. Jackson share a little bit more. Thank you, Doug.